recording. Peace be upon everyone. Dear friends and colleagues, by the mercy of God Almighty, we are able to continue our program on parenting. And we thank our experts, Dr. Habiba and Dr. Najeeb, to provide us the valuable advice as a parents and as a community members and guardians we all need for our children. And some of these advices are very valuable for parents, especially because parents are the key components of these relationship. So in that regard, we are going to discuss another question today, and that question we're going to go ahead and share the question. That is question number 4. So question number 4 we have: how should parents help children to eliminate sibling rivalry? So I would like to start the discussion, but before I start it, I would like to ask our audience, if you haven't subscribed to our channel, please go ahead, subscribe our channel, and that way we ensure that you get our future videos, and this will also help us to get motivation in this regard. So we'll go ahead and start the discussion with Dr. Habiba is the first person to share her recommendation. Dr. Habiba, please go ahead.
Thank you for the opportunity to share my experience with our community members and parents. Okay, so the question is, how should parents help children to eliminate sibling rivalry? So we will start from the, a newborn period. Okay, so the second sibling, a new baby is coming to the house. So the first baby was the center of care, center of for everything. The first baby was the center of care, center of attention all the time for the parents. And then the new baby is coming, means, when the mom is pregnant, at that time itself, you need to tell the child, the child, the new one is going to come, is going to be your sibling, sister or brother. So yeah, that baby will be your friend, like that, some friendship, some good things about that. And yeah, you can play like this, you can play like that, you can tell. Then once the baby comes, even the child has heard everything, but in reality, mom is spending more time with that child, right? So, and then in the hospital itself, the mom is with the baby, the mom has gone, leaving the child, the older child. So, and dad needs to take up the place, more time with the child, or other caregivers at home, grandparents and other people need to replace the time the mother was spending with the child. So, and in the hospital, the baby, the older child is visiting the newborn baby and mom, and then, oh yeah, see, come on, and then always appreciative, as he said. So you have become a big brother, or you have become a big sister now, congratulations. So like that you need to tell. Then also, the mom is going to feed the baby, going to hold the baby all the time, and then this child wants to go jump and sit on the mom. No, like that, be very, very friendly, very polite with the one. If you are like, don't go there, no, like that, if you are going to tell strictly, then again, it is going to cause the rivalry and jealousy, so the child is going to react. So everybody need to be very nice with the older child. And also people will be, full attention is now with the younger baby. So everybody come home, they talk about only the new baby. They don't care about the older one. So everybody need to learn, you need to give attention to the older child too. You are giving gift for the younger one, you get something for the older one too. That way the child will not feel that, that jealousy. So, and even you do all that, there will be some jealousy, and slowly role modeling and being patient and in a very nicer way, storytelling, all those things, we need to overcome that, rivalry. And sometimes you, even with affection, the older one will go want to carry the baby. He doesn't know. So then also in a nicer way, only we need to tell, yeah, yeah, you can have the baby. Come on, sit down. So I'll put the baby on your lap. This is, see, so tiny. And so we need to be very careful. And, after some time, he will grow and then he is going to play with you like that. Always positive attitude. Never, never. Then as they are growing, always treat them equally. No favoritism. No favoritism. Many times, the second child is born means the first child maybe, try to like pinch the baby. Some jealousy will be there inside. Even then, don't be angry. In a nicer way, only we need to overcome that and, be careful. So all that. And um, never, never, no favoritism. Treat them equally all the time. And if you are spending more time with the baby, means, you need to tell the reason for that. I love you so much. You are my first child. You are my first child all the time. And then, so I need to spend little time. See, this is a tiny baby. So I need to spend little time with the baby more. In meantime, you can be with your dad. You can be with your grandma. Like that, you need to tell and then give the proper reasoning, why you are doing like that. And as they are growing, yeah, as I said, no favoritism, always frank. And the next thing is, do not compare each other. Each child is different. Okay, each child is different. Even the younger one. So maybe older one is good in something. The younger one is not in good in something. So don't say, see, your brother, he learned all that early. When he was 3 years old, he can say all ABC tell completely. You are not telling like that. Never, never, never compare. Each child is different and then each child has different talents. So when you compare with each other, there again, the rivalry is going to be there. Okay. And there will be like finding an opportunity to fight with them. So we need to do what all we need to do. Then also sometimes there will be like a small fight, but you be like, try to be neutral. Try to be neutral and also then coach your children. So you need to tell, so coach your children all good points in storytelling always and role modeling. And so even then with that, if there is like a hot spot, they are like fighting at that time, pull them down. And then afterwards, when they are in a cool mood, then, you can tell them. So sometimes a little bit older children, you can allow them to like work it out. Sometimes, they themselves will work it out. They fight and then they will say, it's all right. Okay. So, instead of this, I will give this so that you can give me that. So give them that space too. That way, they don't have that rivalry in their mind. And then they will be like good friends. Okay. So,
That
Dr.
is,
Najeeb.
yes, excellent. Yes, Dr. Najib, I think right now it's your turn from psychiatry and
Oh,
psychology perspective. How could we resolve it, please?
Dr. Habiba explained pretty well from pediatric point of from behavior. Dr. Habiba, you explained very well from pediatric point of view. It's a very interesting topic for behavior science in sibling rivalry. This is where I think so. I want parents to be aware of it. It's a difficult topic. It's a very complex topic, but I will try to make it as simple as possible and go from there. There are factors in this topic which we need to consider. although there are a lot of factors in sibling rivalry, but I will summarize or may concise to only four factors, which in my view are the very significantly important. One is the birth order. The second is the difference in age from the first child to the second child. Now, these two factors are significantly important for child development. So I just want you to be aware, and that is not in your controlled at times. So just keep in that mind that when the second child is born, that's a blessing, you got it, and you have to work with it. But it has a significant impact on sibling rivalry. The other two factors are parenting, how the parents deal with the kids, and the fourth one is biopsychosocial factor. So I feel like these are the four uh, contributing factors for sibling rivalry. So let's go through each one of them and try to tease out what is a sibling rivalry and how to cope with it. The factor which you cannot change, we need to accept that. Factor which we can modify or work on it, we should stress more time on that, right? So parents spend very lot of time to the firstborn child, right? And it has been seen in the different studies, like Dunay and Kidrick in 1982 published a paper about that. That the parents spend more time, they're more invested, they talk, they interact, and they have a higher expectation of good behavior from the first child. As compared to the second and third child, it's somewhere innate in them, and we have to accept that they always expect the best from the first child as compared to the second and third child. But they do spend a lot of time with the second and third, but usually slightly more because of high expectation and all those things. So they would develop very intense relationship with the first child. And of course, when you develop intense relationship, the first child will develop a personality based on the how much time the parents spend, right? It's a reciprocal relationship. You spend more time, you expect more, you work on more, the kid will develop personality based on that, right? That is being seen by, I think, so Sutton and Smith in 1970. That what he found out that the first child usually are achievement oriented based on that. They have self-control a lot based on his finding. That is the strength of it, or the strong point. The other thing which he has seen that they're less socially active because they're put on the spot at times. So they are less socially active, and at times they're anxious too. Now, being anxious is a complex factor because basically there's a lot of other factor involved in any kid who develop anxious feature, because how the attachment between the parent and kid, which we call bonding, how they perceive, how they learn imprinting in them, and how they mirror it. These are the very strong terminology I'm using from behavior science. That's how the child sees the parents, how they perceive, and how they respond back. If they feel the parents are getting upset and all those things, they get anxious that I'm doing something wrong. So this is some feature develop in them because they are trying to follow their parents, but they are not meeting the requirement, correct? So their defense mechanism comes in, the reaction comes in, and if they do not cope well, they can get anxious. So he has found, Sutton and Smith in 1970, when he published that these are some of the features he has seen that the first child may be anxious at time, and that's the reason because of complex relationship can develop. But he thinks anxiety is there, but that's one thing. As compared to the kids who are born later, although they have less achievement orientation, because if the parents are spending more time, less time on the later kids, then they felt that achievement is not the priority, but they have more self-confidence in social environment because they don't feel like I have to do it, I have to grab it, if the parents are not putting that much time. So there is a difference how much parents are putting time on the kids, and how the kids are perceiving from the parents. So that's why I'm saying there are more factors involved than just birth and difference in age. Parenting is a significant factor, and this is what I'm trying to emphasize, that how slightly change in parenting can make a difference because of the order the child is born, right? So that's one thing. And so they looked into the age difference, and Kindrick and Dunne in 1980 found out, that was their finding, that the second child, if they're born less than 3 years or less than 4 years, there's more rivalry, because when they're born close to each other, they're going to compete. There's not much age difference, so they're going to compete with that. And when they compete, there will be a rivalry. Competition means rivalry, correct? So because the parents and the kid has 1:1 relationship, correct? And when their two kids are competing with one parent, their parents, then there's a rivalry coming. So they feel like anything 4 or above age difference is a better than less than 3, but that's one of the reasons they have found in their studies that sibling rivalry is more at a when the age difference is less than 4 or less than 3. Is their finding? That's what I just want to let you know. The other thing, what they have found is influence is greater if the age difference is less and a same sex. Now, I'm using the word sex, so it will be male or female, right? So if the first child is a female and the second child is a female, then the influence is greater if the age difference is less, right? Because age difference with different gender changes, but less age difference and the same gender has a more influence on it, correct? So just keep in mind that they have found that. So the further they apart, they're more accepting. So that's mean that each sibling can take the different role. So usually if the age difference is 6 or 8 years, something like 6 years or 5 years, then what they have found, that was from Gilmore in 1977, he mentioned that the older child take the responsibility just like a parent. If they are not parent, but they take similar, try to get very similar as a teaching module for the younger sibling. So then when they become teaching module, the sibling rivalry get lesser, that you cannot correct it, but I'm just letting the more difference, the sibling rivalry get less. You have no control on that, but at least we know that. So what he found out, he said it's called de-identification or negative identification. So basically what happened is that one child develop a personality, the second child will try to get away from that type of personality. And that's an innate or nature way of dealing with it. Because if they have the same personality, they will compete and the rivalry comes. So the nature allows them to be a slightly different personality because of the environment and the parents are. And so the second child will always try to go slightly different. This was found by Roy and Pluming in 1981. He mentioned that study and all those things mentioned about that. It's called de-identification or negative identification, and this is very significant because basically you come out and be different in that way. So they go well with that, so that's one thing to be aware of it. The other most important thing to be aware of is how you're parenting, and that has been done. A lot of work has been done in psychology and behavior science, but the most work which I want to mention is Diane Berman in 1970s, where she classified parents into 3 different role models, and whichever you want, how they react with the kids are important. So one is a permissive type of parenting in which they are very warm to the kid and very loving to the kid, but they exercise very less control on the children behavior. So they let it go. It's very nice. You're doing good, but they're not controlling if the behavior is going wrong, or they're not correcting that once. And according to her, that is not the best way of raising the kid to be very permissive parent. Correct. The other one which she mentioned about is called authoritative restrictive type. Now, this one, the parents are actually very highly controlling, and they are detached. And the very important is they are detached. That means they are not interacting with the kid's emotion, the feeling, how they're going through it. Uh, this is the way you have to do. I don't care, but you have to get things done, right? And they're no showing emotion or empathy with the kid, not working with that. This is the regime you need to follow. Done deal. Right. So that what she said, these are called authoritarian restrictive type, So she didn't find that is very good for raising the kid. But the third one, which she found, which is called authoritative. In authoritative, they're very firm in their rules, but they are very warm, rational, and receptive. I'm using the word receptive. So they work with the kid to work it out, but they also enforce the rules that needs to be done, correct? She found those are the best one if you're authoritative. So these are the three parenting Diane has mentioned about it very aggressively. She mentioned that these are the three types parents are in her research work, and I think so. That's why I'm saying there are four factor in my view. Parenting makes a huge difference. Parent has to adopt to the kid, and they have to raise to that level. They have to be very receptive, warm, but also make sure they are, enforce the rule firmly, but very receptive and rational and very warm to them. That is one character these are the character you need to know or follow with your kids. And if you do that, parenting, how you parent will make a much difference, because the birth order and the difference in age, you have no control, kind of you don't have control, but parenting, you have definitely control. Otherwise, is biopsychosocial factor is also important. In biopsychosocial, biologically, you don't have much control, but socially and financially, you do have control. So you can work on it to work with the kids to understand the kid and avoid sibling rivalry. So sibling rivalry at times is actually constructive, but it can be very destructive too, right? So you have to use a constructive, not a destructive, So healthy sibling rivalry is always good. You need to encourage them. You have to work with them, but identify if it's a destructive. If they keep on calling names, putting them down, degrading them, this is a destructive. So you have to, how you're parenting your kids, there's an age difference. Are they constructive or destructive sibling rivalry going on? The moment they become rivalry goes into destructive, you need to identify and let them know that that's not acceptable and need to be corrected. And if they are doing destructive, you need to find the cause why they are doing it, because you don't want them to repeat again. So the other kid needs to understand that why we're doing, and we should not repeat it again, because it can happen at other place where the parents are not there, because kids are playing each other and they say something, parents are not every time, every second with their kids. So the real thing is you need to identify where they started and how they can stop it for the future purpose. So I feel it's a very complicated also, but it is achievable. People have done it. They have done great job. So identification of what are the factors and how do we do to work it out will be the best way. This is just my opinion based on different from behavior science, which I quoted, and hopefully that is helpful. I know it's a lot of stuff, but this is the best I can do, and this is just my opinion. Go from there. Hopefully I answer your question.
Yeah, of course. That's a tremendous information for the parents to absorb. And if we have 5 more minutes to continue, if we try to elaborate more related to the style, parenting style that you have mentioned, permissive, authoritarian, or authoritative, as a parent, how somebody will change, or is it something parents inherent behavior, or it is something parents also learn over the time from their parenting, when they were kid. If you can elaborate in few minutes on that.
That's a good question. So most of the time, what is being seen, all the parents love from their grandparents. You know, how they're raised, it goes into their mind, they go into subconscious mind, and there are a lot of other factors involved in that, how psychosocially they are doing, how much stress is, how much work is, and how they're raised. You know, they always look up to their parents, how they raised, and they just copy it, correct? The dynamic has changed altogether nowadays. You know, it's a different world. It's a paradigm has changed. You know, we don't live in that paradigms of 50 years back, correct? The standard of education has gone up. The standard of other lifestyle has gone up. You know, we are catching up with a lot of things going on. It's common to have two parents working as compared to one parent working. It's a common to have a nuclear a family is just one parent and that's it, as compared to the time when they were used to have their cousins there, their other family members there. It's a nuclear family and all those things. So the dynamic has changed altogether. So we have to catch up with the new dynamics of the world, is that how it is. And based on that, we have to work on it. So yeah, definitely our grandparents raised us the best they can. We have to raise up the best we can based on our paradigm, and our paradigm based on what our we have found. These are the, according to Diane, this is the three type of parenting she found it and the results of that. And she found that authoritative, as long as you are warm, rational, and receptive to your kid, and the child understand that. It's very important that the child should understand this, that you are engaging with them. You are engaging in a neutral tone. Even if a child does something wrong, you have to control your emotions and your demeanor, your hands movement and everything has to be controlled in a neutral setting. You know, you have to go back, take your time. You know, you don't need to rush and answer, go and respond back. Take your time when you have your collective thoughts, correct? And think about, put yourself into the kids that when you are that. And I know it's very difficult that when you put yourself as a kid, how you're going to respond, because it's difficult to go against yourself, right? But think about it also that you are trying to work to make it better. There's a lot of factors involved in that, and you have to be very constructive. So when you are very constructive, but understanding their shortcomings too, and also you have to understand what age group you're teaching. You know, behavior science teach you what type of learning they have. You know, the first year of life, first 6 year of life, they have symbolic reasoning. You know, it's totally different type of reasoning. Then you have inductive reasoning, where you add thing and put on the stuff. And then you later on, after age of 12 onward, you have a deductive reasoning. So the child has different type of reasoning they do. You know, internally, this is what from the cognitive behavior theory we learned, that they analyze thing at a different age group at a different level. So you need to be understanding to that what type of thinking they're doing. So I communicate with them well. And you have to understand where they are. You know, you have to know where they understand so you can build up from there. Just communicating, not knowing where they are, you're missing, there's a communication gap. So you need to extract out information from them, that what are their understanding, why they did that, what were the other factors, and what instigate and things like that. So once you have a basic understanding, they have some reason for that. Once you are on the same level of understanding with emotion and with cognition and all the cognitive thinking and all those things, then you have a critical thinking how I'm going to raise this kid to a right direction, because this is your kid. It's nobody else's kid, it's your kid, and you have to work it out every day. So
Thank
that
you.
is a very
Thank you.
constructive. Sorry.
Yeah, I'm sorry. We are end of time, and I would like to thank you very much. And I would like to
Sure.
let our audience know that our program is accredited by Texas Education Agency, and we are fully accredited to provide CPE education for